Welcome to our channel. Today we are tackling a crucial and sensitive question. Can you truly help someone struggling with addiction? This is a topic that affects countless individuals and families, and understanding it deeply is essential if you wish to provide meaningful support. Addiction is a chronic condition characterized by compulsive substance use or behaviors, despite harmful consequences. It's vital to recognize that addiction is not merely a matter of choice or moral failing, it is a complex brain disorder. Research shows that addiction alters brain structure and function, particularly in areas responsible for impulse control, decision-making, and emotional regulation. This means that the person you want to help may not be able to make rational decisions about their substance use, even if they genuinely want to stop. Understanding this neurobiological aspect is crucial in framing your approach. When someone is grappling with addiction, their brain releases increased levels of dopamine in response to substances or addictive behaviors. Over time, this leads to a diminished response to natural rewards, such as relationships, hobbies, and achievements. Consequently, the individual may prioritize substance use over everything else, resulting in a cascade of negative effects on their health, relationships, and overall quality of life. As a supporter, recognizing this shift can help you approach the situation with empathy and realism. It's also important to consider the role of co-occurring mental health disorders. Many individuals with substance use disorders also struggle with conditions like anxiety, depression, PTSD, or personality disorders. These mental health issues can perpetuate the cycle of addiction, as individuals may use substances as a coping mechanism to alleviate emotional pain or distress. This highlights the necessity of seeking treatment options that address both addiction and underlying mental health issues simultaneously. Integrated treatment models, such as dual diagnosis programs, have shown to be highly effective. Encouraging your loved one to pursue these options can significantly enhance their chances of recovery. In your interactions with someone struggling with addiction, empathy is a powerful tool. Many individuals battling addiction feel isolated and misunderstood. They often experience shame and guilt, which can create barriers to seeking help. As a supportive figure, your objective should be to create a non-judgmental environment where they feel safe to express their thoughts and emotions. This involves active listening, truly hearing what they are saying without jumping to conclusions or offering immediate solutions. Validate their feelings and acknowledge the difficulty of their situation. Sometimes, simply knowing that someone is there to listen can be incredibly comforting. Understanding the stages of change is another critical aspect of providing effective support. The trans-theoretical model outlines a series of stages: pre-contemplation, contemplation, preparation, action, and maintenance, that individuals typically move through when addressing behavioral changes, including recovery from addiction. Recognizing which stage your loved one is in allows you to tailor your approach. For instance, if they are in the pre-contemplation stage, they may not even recognize their behavior as a problem. Your role here could be to gently introduce the idea of change without being confrontational. If they are in the contemplation stage, they are likely weighing the pros and cons of their substance use. This is the time to engage them in discussions about their motivations for change and the potential benefits of recovery. Relapse is often seen as a failure, but it is important to reframe this perspective. Relapse rates for substance use disorders are comparable to those of other chronic illnesses, such as diabetes or hypertension. Studies show that many individuals experience multiple relapses before achieving sustained recovery. When a relapse occurs, viewing it as a setback rather than a catastrophe allows for a more constructive conversation. Discuss what led to the relapse, identify triggers, and collaboratively develop strategies to manage those triggers in the future. This kind of open dialogue can foster resilience and reinforce commitment to recovery. Encouraging self-compassion is another key element in supporting someone with addiction. The journey through recovery is fraught with challenges, and individuals often engage in negative self-talk that exacerbates feelings of shame and worthlessness. Helping them cultivate a sense of self-kindness and understanding can be transformative. Techniques that promote mindfulness, such as meditation or breathing exercises, can help individuals observe their thoughts and feelings without judgment. This practice can be particularly effective in managing cravings and emotional distress, allowing them to respond to challenging situations with greater calm and control. The environment in which an individual recovering from addiction resides plays a significant role in their success. Substance cues, people, places, and situations associated with past use can trigger intense cravings. Therefore, it is crucial to assist them in creating a supportive living environment that reduces exposure to these triggers. This may involve helping them find sober living arrangements, encouraging them to engage in new hobbies, or facilitating connections with peers who support their sobriety. Establishing a network of support is vital, as social connections can provide both accountability and encouragement. Lastly, remember that you cannot fix someone. Your role is to provide support, encourage professional assistance, and be there as they navigate their recovery. This journey is ultimately theirs to undertake, but your compassion, patience, and understanding can make a profound difference in their path toward healing. In addition to individual therapy, family involvement in the recovery process can be transformative. Addiction impacts not just the individual, but the entire family system. Family therapy can help address relational dynamics that may contribute to the addiction. It offers